My name is Crain, and I'm one of the physicians at the Banner Concussion Center in Phoenix, Arizona. I'm specially trained in sports neurology after completing my fellowship. And here at the Banner Concussion Center, we provide specialized care for concussion of all types, specifically in sports. Part of my job on a day-to-day basis is educating people about concussion once they've had it. And so there's a few things I think that are important to know beforehand. The first thing I like people to know about concussion is that it's a treatable condition. But first it has to be recognized and diagnosed appropriately. Here at the Concussion Center we have multiple specialties that all specialize in the care of concussion. And that ranges from treatment of the headaches or balance or eye problems, all the way up to the cognitive. One of the first things you do when you come to the Concussion Center is meet with a physician. And here at the Banner Concussion Center, we have multiple providers, and each is unique in their approach. Concussion is a treatable condition. The first thing people should know is that right after the concussion, that's when symptoms are going to be the worst. And that's when you have to take everything a step back. And from that point, then it should be gradually increasing your activity. That's physical, cognitive, even emotional. And so the first few days can be a little rough. And then from that point, in order to maximize the recovery and speed the recovery, you have to slowly reintroduce things back into your life. For kids, physical activity is very important. We know that it's a regular part of their daily routines. And if you don't get good physical activity, then you're going to have worse symptoms. One, because you're not getting the normal physical activity you want, and two, because physical activity is a good way to heal the brain. So the old way of thinking about concussion was that we put you in a dark room and don't let you out until you're better. And now we know that that's not the right way to treat concussion. We know that people that get out earlier actually do better, faster. I think that having the physician that's familiar with concussion is very important. Also, a very important role is played by athletic trainers at schools. And so if there's ever any concern about concussion, either on the sideline or afterwards, the following day, or maybe in school the next day, or maybe there's just a concern brought up by a fellow teammate, they need to speak with a healthcare professional that's familiar with recognizing, diagnosing, and management of concussion. Outside of sports, when we're talking about more adult concussion, that can be falls, it can be car accidents, other things like that. Sometimes the diagnosis can go unrecognized. For example, if somebody has a broken bone in the injury, a lot of times the focus is on that. And if the concussion symptoms don't come to somebody's thoughts for a few days because they're dealing with the other injury, sometimes it can be missed. And so it's always a good thing to recognize that a concussion could have occurred. Even if there's no blow to the head, even a blow to the body or a whiplash-like injury can result in a concussion. Often, if it goes unrecognized, it can't be treated appropriately, and so the recovery can be prolonged. And it can be very confusing, and symptoms can actually get worse because people don't know what's going on and why they're feeling the way they do. But whenever you have a concussion, I think it's a treatable condition, and there's all kinds of ways to treat it. Again, here we have multi-specialty clinic at the Banner Concussion Center. It really tries to address all aspects of the injury to maximize recovery. And the speed of the recovery is obviously very important. We want people to get back to sport. We want people to get back to work as soon as possible. I think those are the most important things when I think about what I wish people knew about concussion before it happened. Because right after the injury, you're not thinking right. That's part of the injury. And so if you know what's going on before, I think that it can definitely help you after the injury occurs in that unfortunate situation. For the last few years, I've been a board member of the Brain Injury Alliance of Arizona. And I first became familiar with the organization when I was doing my training in brain injury, and found it to be a very helpful organization. As I became a board member, I hope to help shape the organization and make decisions going forward on helping those with brain injury as best as possible. And one of the things that I've really found I really appreciated about the Brain Injury Alliance of Arizona is all the resources that they help patients get that we don't really provide at some of the clinics. This is the social support. This is the information on different resources that sometimes we don't have knowledge of. And so that's what they specialize in. And I found many of my patients have told me about the Brain Injury Alliance independently without me mentioning it. But I always like to give them information if they haven't heard about it. That includes the patients, those with the brain injury, as well as family members or friends who don't really understand the injury and don't understand what their loved one's going through. And I find it an immensely useful resource. And that's one of the reasons I like to join the organization and be part of it.